I do want to thank all of our employees and family members that may be listening today. I'd like to take this opportunity to give you an update on a recent news that we shared with our staff. And this really only applies to ADEC staff, but it also is a concern of families. So earlier in November, the Centers for Medicaid and Medicare Services, which is the organization that funds providers like ADEC, as well as a multitude of other healthcare providers across the United States, and yes, everybody in Indiana that is like ADEC, they sent out a requirement that says employees of a company, an agency, a provider must be vaccinated with the COVID-19 vaccine, or they get an approved exemption. This is very important. There's very tight deadlines. By December 5th, every employee in ADEC must have either their first dose of a two-dose process, or their single dose from Johnson & Johnson, or get an approved exemption, and I do want to talk about that. They need to get full vaccination by January 4th. We're going to make available on our website, when I'm all done with this live Facebook, that's going to have the flyer that CMS had provided, and we sent it to every employee, and we will share this to families, that says that agencies need to do this, or they will be in non-compliance and the funding will stop. If that happens, it becomes extremely impossible for nearly any provider in the United States, in Indiana, even our colleagues that might be in another county that surrounds us, to be able to provide the services that we need to do for those that we care for. I do want to share that we care very deeply about our employees, and we understand a vaccination is a personally held personal decision. This week I've been visiting as many as possible in our locations, talking to employees. We have sent letters home. I know I do emails, and not everybody else can be on emails. But what I'm sharing to employees, please know that this is not an ADEC decision. Yes, our board of directors is aware. Yes, the executive team and all the management is engaged. But this isn't something that we just decided to do. This has come from CMS. CMS is providing to the families. CMS is the organization in the United States, Centers for Medicaid and Medicare, that provides that funding to your loved one who is disabled, that has an intellectual and development disability, and they're receiving services from any provider. That funding comes through them, and then it comes to us. We get reimbursed after the fact. Maybe a month later, sometimes longer. We just got to get our paperwork done. But we get reimbursed after the fact. But that money comes from them. And as a result, they're saying whoever ultimately provides this service, they must be vaccinated. Like I said, we will post this on our website because you will find it applies to a lot of other places. It could be health centers, it's hospitals, it's long-term care facilities, it's various forms of the services that we provide. So ADEC across the board. So to our employees, here's your options. Number one, if you are vaccinated, submit your proof of vaccination to HR. And we have a fantastic team here. You can contact them, and you need to submit the documentation. We do need the documentation because when they start next year, they're going to be coming through and they're going to be doing surveys. They're going to send people out to ensure that we're compliant. We have to show proof and documentation. The only people that will see that is HR. I don't even see it. They will scan it in, they'll put it in their secured employee file, and then essentially once you're vaccinated, you were done. HR will send you a note and say, congratulations, you're fully vaccinated. You are done. If you're not vaccinated yet, please, by December 5th, you need your first dose of a two-dose vaccine, or you need the single dose. And then by January 4th, you have to be fully vaccinated. So that's that's an option. But the big option I want to just share with you, We have the ability to give exemptions, and it is, again, a personal decision that we respect. But following EEOC guidelines, and we have been engaged with um, discussions with CMS at a United States level. 10,000, 20,000 people are in these calls. Last week, I met with Dr. Dan, which is how we call him, who is the lead for FSSA in the state of Indiana. And I talked to Kim Opsel, who is our director of DDRS, and they reconfirmed to us we must do this. But you have an exemption opportunity, which says you talk to HR. We've sent all employees a form, and there's two ways that you can get an exemption. Number one is a medical exemption. Your medical doctor needs to sign it and provide documentation. They're familiar with this. They'll know what that means. You get that, you send it to HR, and you will have an approved exemption through a medical reason, and they'll put it in a file, and then you will be compliant, and you can continue to go on to do your job. The exception will be because you're not vaccinating, you still have to wear this mask. Now, I have people in my office right now to make sure I'm doing this right, and I will tell you, at the moment, they're not wearing masks because I do know they're vaccinated. They've shared that. And as a result, if you are fully vaccinated, you won't have to wear your mask. But we are still doing all the other protocol, cleaning and all that other kind of groovy stuff that makes our environment safe. So you can get a medical exemption. The second way that you can get an exemption is more broader applied, and I will tell you it's a very sincere one. But if you come and you put it in writing, and again, there's a form that you would go to HR and say that you have a sincerely held or deeply held belief, observance, or practice that you firmly believe would be prohibitive for your own peace of mind, your own spiritual well-being. And I know it's called a religious thing within the EEOC, and religion is broad. It doesn't mean a brick and mortar that you go to church or you have a place of worship every week. That's not it. We're not going to double check. We're not going to follow up, but we are going to respect the fact that the law does give you an opportunity to say, I have a deeply held, sincerely held belief, practice, or observance that would say getting a vaccine would just be prohibitive, and it may be faith-based. There's absolutely, and that is deemed an acceptable accommodation to make, an acceptable exemption in the CMS rule. You submit it to HR, you have to get that in by December 5th, and then you are done. This doesn't apply to the booster, it's just the current single dose or two dose COVID vaccinations that are out there. So again, with employees, you have an option. Go get the vaccination you have between December 5th and January 4th, or come to HR and submit for an exemption. Those exemptions will go to HR. There's only probably 2 people who will see that, and they'll talk with you, walk it through, and if it's approved, then you're done. And then there'll be no impact on programming. There'll be no impact on employment. You won't lose your job. Let's say if you get an approved exemption, you're not going to lose your job. You are compliant with the intent of CMS. Now, what CMS has shared, there's no testing option. So you vaccination or approved exemption. There isn't a testing option. But we are trying to be very flexible. We know it's a tight deadline. I will share with every employee that because of this personal commitment, and we know it affects everybody, and it affects our clients a lot. They're nervous, like what's going to happen? Is our staff going to leave because they need to comply to this? I do want to go back to the very beginning when I said this applies across the United States. I know there's a lot of other things that you can read in this, but this applies to anybody who falls in this window of funding or where you are getting your services. And they could come in, they could shut us down, they could do a complaint, and we really don't want that to happen. And I do want to share to our employees, by helping us maintain this compliance, you will be eligible for a retention bonus that we will pay out $500 to every employee in May of next year and $500 to every employee in November of next year. And that is a genuine thank you to our active employees that are helping us to be compliant. Our board of directors unanimously supported this. They understand how difficult this may be, but it is a way to thank you. So again, compliance is get the vaccination, and by December 5th, one dose or the first one of a two dose, and then January 4th, be fully vaccinated, submit that paperwork to HR, and then you're done, and then you'll be eligible for the retention bonus. So the families out there, continue to have faith in ADEC. We believe very strongly in our mission. I'll just share with you this morning, I was with a bunch of clients at our Gaining Grounds coffee shop, which is open, and it's really a delight to have that exchange with them. We really don't want to have to disrupt their lives. And so I'm doing a shout out to everybody. Please help us. This is a mandate that is coming from the Centers for Medicaid and Medicare Services, CMS, at a federal level. The state of Indiana has said we need to comply, and agencies like ADEC have to comply. So if you have a loved one that's living in what we call intermediate care facilities, what we in ADEC affectionately call group homes, and we have a lot of clients that live in group homes. If you live in a group home, you have to have vaccination amongst your staff or get an exemption. And then as a client, you have an individual right to make your own choice. So we're not infringing on families. If you have any questions, employees, please, please, please reach out to HR. You can reach out to me directly. You could reach out to Michelle McGuinn. You can send me an email. I know people can click on my name out on our website at adecinc.com, or send me a ADEC Facebook message to adec@infoinc.com, and someone will get back with you. But on behalf of ADEC, I truly want to do a shout out to our employees. Thank you. We believe in you. We respect your personal decisions. Work with us. If you have any questions, call, and we will keep ADEC in compliance, and we'll just have a great Thanksgiving, a Merry Christmas, a Happy New Year, and all that other good stuff. So thank you, and families, thank you for including us in your lives. Bye-bye.